All right. Thanks again, y'all, for coming here today. I'm super excited to introduce Beth Adams. Beth is a Lean and Continuous Improvement Manager for the Home and Community Living Administration, which some of y'all might previously know as the Aging and Long-Term Supports Administration over at the Department of Social and Health Services. And we're super excited. Beth is just one of our resident collaborators. She was here with us a couple months ago to help present as we talked through some of just the changes, workforce changes occurring in our enterprise. And she's also presented during our first year of the community to practice, and she's a resident Lean Conference presenter. So we're just super excited, to have you here to talk through value stream mapping and just to share your experience and knowledge. So without that, I'm going to mute, I'm going to zip it and hand the mic to you, Beth. Thanks so much.
All right. Well, thank you so much, Teresa, and thank you, Talia, for working in the background. And good morning, everyone. As Teresa said, my name is Beth Adams. I use she, her pronouns, and I am with HCLA, the Home and Community Living Administration. Was formed May 1st and comprised what was formerly known as ELSA and the community side of DDA. Just a little bit about me. I have about 30 years of experience in the field of aging. I am a social gerontologist, and I'm also a Lean Six Sigma black belt with about 10 years of experience in Lean. And I don't know, I've sort of lost track, but probably at least over 100 projects, either as a member or lead. And my introduction to Lean and my initial Lean training came from my time when I was working at the University of Michigan Health System. My introduction to Lean was from a very much sort of a pure Lean philosophy, people first, get rid of waste, make things easier for those doing the work, and just really focused on creating value for our customers. So as we get started in talking about VSMs, next slide, please, Teresa. When I talk about value stream mapping or a value stream map, the visual here is what I am talking about. This is an old draft example of a value stream map around presumptive eligibility. There is no timeline on this, but some of that information is captured in the data boxes. I have found that during my tenure with DSHS, value stream mapping, or VSMs is the acronym, is often used to talk about any Lean event or any Lean tool. I remember my first day of starting at ELSA, and my then supervisor was giving me a tour of the office in Cubicle City. And as we walked past an outer wall, she points and says something to the effect, "And this is a VSM we did not that long ago." And it was not a value stream map. I don't even think it was a process map. I remember it being circular, and it wasn't even like a PDCA cycle or a DMAIC. So being the Lean educator that I am, I said, well, that's not a value stream map. That looks like I can't remember whatever I said. And they came back and with a very definitive, oh no, that's a value stream map. And so my response back was much more diplomatic this time. I have not seen a value stream map that looks like that before. So I've learned that when I'm asked to do a VSM or really any Lean event, and this is what you should do anyway, is I really want to identify, well, what's the problem that you're trying to solve? What's the end goal? What does done look like? All right, next slide, please. All right, so today we're going to cover at a very high level the what and why of a VSM, its components, how to get started creating one, and then we will have time at the end set aside specifically for questions. But do feel free to ask them as you have them, depending on the content. But I might save it for the end if it's not something that's going to be covered in this presentation. And so advanced thank you, Teresa, for helping to manage the comments in the chat that are coming through. All right, next slide, please. So the what and why. So what is a value stream map and why do we do them? Next slide, please. So a value stream is all the activities or steps an organization must do to develop, produce, or deliver a service, product, or an experience to a customer. It's the totality of a service delivery system. If we were to create a customer journey map, and customer journey maps are used to sort of capture the experience of the customer as they move through the process of accessing and getting services. It would follow along with the value stream map. Next slide, please. So a value stream map then is a visual of that process. It is going to be linear, and it's going to show the flow of materials, goods, information, or data from the suppliers, which is in the upper left corner, all the way through to the customers in the upper right corner. A value stream map is going to display not just like the process, what happens, who's doing what, but also all the issues, waste, challenges, problems, issues, where there's bottlenecks. It's going to show interactions with databases or other inputs. There's also some time elements. So it's going to show how long it takes to complete each step of the process, as well as how long the entire process takes from start to finish. And it includes all the waiting, because most processes do have some wait, either within each process step or delays, time gaps between each process step. And so again, value stream maps are used to visualize the entire process of how a product or service is created and then delivered to a customer. Next slide, please. So if I had to summarize the difference between a value stream map and a process map, it would be this, is that there's a greater intentionality behind a value stream map than a process map. Value stream maps are done when leadership is on board and committed to making a change to the current state. Value stream maps also really focus on creating value for the customer. I'm going to talk a little bit later about value add and how you know that something is a value for our customers. Whereas process maps focus more on those who are engaged in the process and looking at improving workflow. Next slide, please. All right, so here are some more specifics as to the differences between a process map or a flowchart and a value stream map. So with process maps, really looking at how something works, looking at both the effectiveness as well as the efficiency of a process. Process maps or flowcharts often include decision points or different paths that could be taken depending on an action that is taken or the outcome of a decision. It can be standard or a swim lane. And a swim lane is going to show the different roles or different phases of a process. And swim lanes are really great if there's a lot of handoffs between different roles or different entities, as that tends to be where there's bottlenecks or things can back up, miscommunication opportunities. So swim lanes are really useful for when that's occurring. And process maps can be extremely granular, so they can have a lot of detail, very specific, or they can also be very high level. And then a good values or a good process map can also be used as a training aid, especially if it's to accompany a procedure manual or a procedure guide or a standard operating procedure, depending on what you call it, where you work. But it can really be used to help accompany that. And sometimes, especially for visual learners, seeing it mapped out is easier to understand than all the words that are needed to explain what happens in a procedure manual. And then with value stream maps, You do a VSM when you know that the process needs improving and there's commitment to do the improvement work. Value stream maps are great at identifying where there's waste, and then again, with that commitment to eliminating it. Value stream maps are also linear, so you're not going to see any decision points. Value stream maps are going with the assumption that things are moving forward in the direction in which they need to deliver the service or product. VSMs are also going to show interactions within each step and between steps. So how information flows or materials, interactions with databases or other information systems. VSMs also tend to be big picture, so they're not going to have that extreme high level of detail. They are also data driven, and I'll be talking about some of the data elements in a little bit. But that's another big difference between a VSM and a process map, is that VSMs are going to have several data elements. And then a VSM will always need to have a charter, or at least it should always have a charter. And I'll talk about that in a couple slides. Any questions before we go on? And I'm just seeing a lot of in the chat, some agreement with the VSMs and process maps and flowcharts. Thanks for that, everyone. Okay, next slide. So VSMs, they can also help to align teams. A visual map can make it easier for everyone involved to have a shared understanding of the process, and as a group, collectively identify where improvements can be made. It can also help to align cross-functional teams around common goals, and it gets everyone on the same page. With improving process flow, we can visualize bottlenecks, delays, and other waste on a map more easily than we can in just thinking about or talking about processes. When we visualize it and document it, teams can then prioritize and then systematically eliminate them to streamline operations. It also makes it easier to design the future state, a future state that promotes better flow, smoother flow, reducing waste times, and just overall to improve process effectiveness. And then, as you know, part of Lean is to eliminate waste, and value stream maps help organizations and entities to identify where waste is occurring, as well as categorizing the different types of waste. Is it a wait time? Is it unnecessary motion or rework, defects or errors? Non-utilized talent. Do you have staff sitting around waiting for work to come to them? Although we know in government that that's not usually a problem. If anything, it's the opposite. And when we identify waste, we're able to map it out and visualize it. It makes it easy to spot steps in the process that don't add value for the customer. An example could be providing the same information multiple times to different entities. And then really, fostering that continuous quality improvement mindset. The VSMs are really a foundation in continuous improvement initiatives and foster that culture of problem solving, encourage cross-functional and cross-team collaboration to really address the root cause of problems. An easy root cause analysis that I like to use is the 5 why. You just keep asking why until you really can't ask why anymore. And everyone agrees that you really can't go any further. Most problems are going to have multiple root causes. So again, teams can prioritize and start to implement sustainable solutions. And streamlined processes are again going to improve the quality of the final service or product and are also going to improve the overall customer experience. And then this last one here is really important to involve both a current state map and a future state map. we need to make sure that we are designing for that ideal state. And so we need to develop a future state map, not just sort of talk about the ideal, but a lot of times with VSMs or improvement efforts, we don't get to this step. We don't get to the mapping out of what would the ideal state look like. But also recognizing that it's not going to be an overnight change, but an iterative process over time, sort of where that continuous improvement comes from, is that it's the iterative. We're always striving for better. And, our environments change. I think we all, especially in state government, recognize that right now with the budget impacts and the staffing reductions that we've all experienced. We need to figure out how to work in our new environment. And so what do our processes now need to look like to maximize our resources? And a question I always like to ask when I do a VSM is, do you want to know what the ideal is? Because if leaders are like, I don't know, maybe, that will sort of influence whether we do a VSM or to what extent we do a VSM, or, to what extent we're going to do a root cause analysis. But really asking, are you committed to providing the resources, time, and space to get there? Next slide, please. So when we think of things that are of value added, what are some of those things that we value as customers? I know one thing I value is providing my information just once, or not having to have duplicate data entry points. I remember being at a doctor's office, I don't know, last year sometime, and, did the electronic information forms in advance, get to the office, and they asked me for, they hand me a sheet of paper and asked for the exact same information. And I'm like, you already have this. Why do you need this? And they're like, well, we like to have a paper system for backup in case our computers go down. And I'm like, can't you just print it out? Why do you need me to do it? Anyway, I think we've all been there. But more importantly, I think we all have systems where we expect that of our customers at different times. So thinking about, what does our customer value and how do you know? So to identify our value added activities, we really have to ask, what is our customer value? And we need to capture the voice of our customer. Next slide, please. So when we talk about value added activity, there are a lot of things that our customers might value. Things like clear communication, having control and options, being treated with dignity, empathy, and respect, having services that are provided in a culturally relevant manner, having provider availability, timeliness of services, and also transparency. But within Lean, there are 3 things that really need to be present for there to be customer value. Yeah, I'm seeing in the chat that the customer is willing to pay for it. Absolutely, that's a key thing. So first, it does need to meet a customer need and matter to your customer. And we know that by asking, is this something that you'd be willing to pay for? And even when, a lot of our services, there's not necessarily a transactional cost associated, but being able to identify, is this something that you would pay for if that was the case? So I know things that are of value added for our customers could be, in the social service space, conducting the assessment to determine eligibility, or conducting an investigation to identify if there is fraud or abuse occurring or neglect occurring. It is processing the contractor application so that they're able to provide services themselves. And then second, the process step needs to perform a function. So there needs to be a change to either the form, fit, uh, or function of the material, data, or information. So there's something that's actually done with it. There's a transformation. So in reviewing an application, is the review just checking a box? Yep, did it. The policy says we have to do it, but I don't do anything with it. Or is someone actually taking that information and doing something with it? And then finally, it needs to be done right the first time. This means that there is no waste, no rework, no excess waiting. It can't be burdensome to the end customer, but it also can't be a burden to those doing the work, our employees, our partners. When this happens, it's really a waste of everyone's time, energy, and effort, and it brings no value to the customer. So the idea of this is to have quality at the source, or JIDOKA. That is, it comes to you without defect and error, and it also moves on from you without defect or error. So if you are a Lord of the Rings fan, think of Gandalf at the bridge of Khazad-dûm in Moria as he's talking to the Balrog, shouting, "You shall not pass." We want to do that to problems. We want to do that to errors. So that, if an application or form comes to us and there are problems with it, we don't send it back and, make other staff fix things, but that we're able to fix it in real time, or at least if there is rework that's needed, it's really limited. All right, next slide, please. All right, what does the customer need and want? So how can we design our processes around the customer needs? And so we need to ask, who's the customer of this step? Most of our processes are going to have multiple customers, ranging from our internal customers, our fellow colleagues, or coworkers, or community partners, to those benefiting from the service or product being offered or provided. So, asking who is being centered overall in this process. I think, let's go to the chat. I'm going to ask folks a couple questions. So, is what is best for staff always best for the customer? How do you find that balance of what works for your customers without being an unreasonable or unnecessary burden for staff? And how are you capturing the voice of the customer?
Yeah, great questions. Ooh, Vicky says, secret shop your city services. Ooh, I like that. Very good. Yeah, one thing that we have been doing now that, our customer experience, we're shifting towards customer experience is a lot of customer interviews, whether that's, focus groups, one-on-one, really understanding the experience from their perspective, and not what we perceive the perspective to be. So love that. Mm. Daniel asks, is anyone familiar with the app development term dog fooding?
Well, I'll join in because I'll explain it because I think it's a fun
Yeah.
term. So, Facebook a long time ago had an issue that no one used their Android app because all of their developers were iPhone people. And so they made them dog food it essentially, made them eat their own product essentially. It got them all Android phones and had them use the app, and it drastically improved the product when they actually had to use the end result. So, it's another term for when you're eating their own food. I think it's fun.
Oh, I love that. And that makes so much sense. Like experience what everyone else is going to be experiencing. Yeah, great, Daniel. Thank you. Jeremy states he's integrated a method called Target Universalism, which identifies different types of customers, their needs, and then works with a larger group of service providers to serve everyone. Ooh, that's great. Alicia, hey Alicia. She says human-centered design approach. Yep, absolutely. Building, creating, designing with the customer's input. Love, love, love.
Nice. All right. Can you guys hear me?
Ooh, yes, it's a
We
tiny bit
can.
muffled, but we hear you.
All right. Is that better?
Yeah, what do y'all think? Sounds good to me.
Hey, can you do a check one, check two, Beth?
I know. Sound
Mic
check. Check
check.
one, check two. I'm seeing lots of thumbs up. All right.
Perfect.
I have not held a phone to my head in a really long time. So this is going to be a new experience for me. So thank you, everyone, so much for your grace, for rolling with it. And yeah, you guys are all awesome. And thank you for all your discussions about, what does the customer need and want and all of that. So next slide, please. Um, did we miss the slide or maybe? Okay.
Sorry, I think I went too fast. Is components looking right, Beth?
Yeah, so I probably made some slight changes too between what I sent and what my final is, but that's all right. So yes, who is our customer? This is what I wanted. Who is our customer? So who is your customer? Who do you serve? It could be someone from whom you need information or the next person to receive your product, whatever that product is. What's missing from this list when we think about groups of customers? What other entities should be here? Drop it into the chat. Yeah, your peers can be your customers depending on the work product. I'm seeing other staff. Yeah, those who use your services, absolutely. Yeah, produce service too, absolutely, Whitney. So we also, as we're designing processes or redesigning processes, need to think about who is our customer. And also who's our customer at this step of the process overall, because each process step might have a different customer. Yeah, community partners. Yeah, as we discussed, yeah, you can be your own customer when you work in government. Absolutely. All right. Yeah, everyone, that's exactly having a strong sponsor, project charger, A3 is critical. Absolutely, Jeremy. And I'll talk about that in a little bit, especially when we talk about SIPOCs. All right, so we can now move on to that component slide. All right, so we've talked about the what and why, and now we're going to spend some time looking at the components of a VSM. Next slide, please. So one of the key elements of a VSM is a process box. This is really a high-level capture of who is doing what at a given step. Keep it short. Acronyms are okay. Make sure that you're focusing on the role, not a given name. I was did a value stream map not that long ago, and someone asked me, what is that icon supposed to be where it says like PE intake worker? And the way it was taught to me is it's sort of a bird's eye view of a person with their arms stretched working. So sort of, a person with their arms out doing the work. Hence, that's the role icon. And it's important to make sure that you are, again, keeping it brief. Next slide. So beneath each process box is going to be a data box. This is going to capture the where, so the department or location. Other things that could be here are the number of staff available, how long it takes, so cycle time, process time, wait time is an important thing to include, touch time, and then other specific data elements that are important to your given process. Next slide, please. So some of those time metrics, I wanted to provide some definitions. So that cycle time or process time. This is the total time that it takes to complete a given step or task of the larger process, and it includes that wait time. Touch time is the amount of time it takes to actively work on a given step. So it's a waste-free time metric. And then tact time. This is a measure of how often a process needs to be completed in order to meet customer demand. Yeah, VA and non-value added time. Yeah, because there are things that are exactly. There are things that are not value added that aren't always wait time. And some of those NVAs, non-value added time, are inherent in a process, required because of policy or technology limitations. When I was preparing for this, Talia had asked if I would talk a little bit more about tact time. So if we can go to the next slide, please. So tact time is, think of tact time as a metronome. So it really determines that pace or beat at which a product or service should be completed based on customer demand. But it can also help with resource management. So how many people, how many staff do we need to keep pace with our demand? And that information then can help with crafting decision packages and requesting additional FTEs, or even developing policy, especially around the timing of which something needs to be completed. And then when calculating tact time, it's not always going to be realistic with current resources. But also, with doing value stream mapping, it's really an opportunity to identify where there might be waste within a process and how can we streamline things. So an example could be looking at a call center. You can see up here on the slide, you have 5 staff, 8 hours a day. We have some information on how many calls on average they're getting a day. So you divide the two and you get the time in which staff should be completing each phone call. But, that's not to say that every call is going to need to be completed in that time frame. But if calls are taking, an average of 10 minutes to complete, then staff are going to feel rushed, pressured to rush calls, which is going to adversely impact the customer experience, and calls are then going to go unanswered. But adding to that complexity is that in a real world situation, we don't really work 8 hours a day. Staff are not going to be working on calls every minute during this time frame. We have required meetings and trainings, sick leave, vacation leave, breaks, potential for jury duty, and other things that take away from the actual time staff have available for answering calls. Next slide, please. So this is then framing this in a real world scenario. So another way of using tact time is flipping the script and asking how many staff are needed for the work. So back in late 2019, early 2020, I was working with the Home and Community Services Imaging Unit. They were going to be rolling out a pilot project statewide. They had been experiencing a significant backlog of paper mail. So I mapped out their entire process of all mail types, worked with the staff to identify pain points and challenges with the current process. And this calculation here on the screen sort of came about by accident. I was talking with their leadership team about the volume to available staff and the challenge they had in getting new staff. And I told them that I had a formula that might help. Next slide, please. So this is a formula that is really used to calculate the annual direct hours based on a given role. And then you can also make, adjustments that are unique to a given individual. So if you have someone that's routinely out for military commitments, you can factor that into the calculation. But really you want to, take the state holidays, and this was done when we had 9 state holidays, vacation, sick, personal, training hours, roughly how many hours you have of training, jury duty. And so you then get your adjusted hours, which, in this scenario, it's about 86% of an FTE. But then, you have to factor in things like breaks, required meetings, and such. And so you can see that there's, different percentages of the direct hours, anywhere from, 65% to 80%. So you can then use, depending on the role, use the adjusted available hours to determine, what is that tech time? What is your capacity to take on new projects or tasks, and to help with prioritizing projects? So this exercise that I did with the imaging unit led to their requesting 8 additional staff. They received 4 new FTEs. And I believe also that at the time they had 3 non-perms who were made permanent. So they didn't get everything that they wanted or needed. They did get something, and it did make a difference. Also, last year with preparing for the new biennium, I worked with some folks who do contract monitoring, and I put together an iconograph that showed the disproportionate workload compared to what was required. Did the math, and I showed how long it would take at current staffing levels to complete the contract monitoring for their body of work. Unfortunately, there were new funded positions. So this is where you have an opportunity to acknowledge to staff that yes, you are drowning in work. And this is something that the ledge is not funding. So then, looking at our processes, looking at our systems, how can we streamline the work? What policy or contract changes need to be made to make the work more manageable while still serving our customers? Where can we find efficiencies? What can be automated? What should be a paper review versus an on-site visit? Yeah, great for expectation management, absolutely. It's like, well, you might want this, but this is what our capacity is given our current resources. Yeah, I'm seeing here in the chat, we use a 60% on our team and do it on a monthly level. Yeah, it really helped to balance urgent assignments with long-term strategic efforts and prevent burnout. Love that. Next slide, please. So just wanted to share with you, for those who are curious, this is that map that I made of the imaging unit of their process at the time. So you can see that there's a great deal of complexity involved in imaging and indexing and this related sub-processes. Doing this work also helps staff to realize just how much there is to the work that they do, especially for roles that tend to be overlooked or just don't, have the same perhaps panache that some of the other roles have. When I did this, I had a staff person comment that I didn't realize that we did all of that. And it really helped to give them a sense of pride and greater ownership in what they were doing. Next slide, please. So what are some other metrics that might be in that data box? Depending on what you do, you might include batch size, what's the throughput rate, so, how many applications are processed from start to finish in a given time frame, completion rate, something that is not on here, but that is also, I think, important to think about, is called FTQ, or first time quotient. So it's the percent of time that the step is completed accurately without any rework or error. Next slide, please. And then beneath each process box and data box, you have so between the two process steps, you have a wait time. And then for each process step itself, you have a wait time. And then you're either cycle time, process time, touch time, depending, whatever time metrics you want to measure. So at the very end of your process, you have either a total wait time, a total cycle time, process time, or you can also have a total touch time and then just adding the two to know how long it takes. So then when you're going back and looking at your value stream map and starting to identify where you have challenges and issues, you can focus on areas where you have significant wait time or chaos. Reduce the wait time, you're going to improve the effectiveness. Next slide, please. So this is then what it would look like if you brought all those three elements together: the process box, the data box, and the timeline. But this is just part of the value stream map. We also then have additional visual cues and icons. Next slide, please. So different symbols, icons. So identifying where you have issues. Where is there rework or waiting? Bottlenecks. What is your inventory like? So this is going to be, the symbols that you use are going to be very specific to your individual work. Here the key is for a value stream map that I did not that long ago, where there was some overlap of work or there was some similarity of activity across different roles. Next slide, please. So you're also going to see different types of arrows on a process map. You're going to have push icons, pull icons, arrows, as well as manual information flow and electronic information flow. So if you're seeing a lot of manual flows, might want to think about when you're doing your analysis, what can we automate? Where can we add in some electronic information flow instead? Next slide, please. And then you have some additional icons like your supplier and customer. That shape is supposed to be a crown. So sort of think of your customers as the kings, queens of your process. Database. So you're going to have draw, push, or pull arrows, or manual information flow, electronic information flow between a process step and a database. You might have a first in, first out icon to indicate that you deal with things as they come rather than a random. Depending on the complexity of your process, you might also want to have an on-page or off-page reference where you click on it and it will link to elsewhere on that page within Visio, or off-page going to another page within your Visio document. Just a note about on and off page references. If you are in Visio and saving your document as a PDF, on page references won't be saved, but off page references will, as long as you save your document as preserving links. Next slide, please. And then you can add, some other visual icons to identify, where you have bottlenecks or issues, chaos, waiting, time delays, or a Kaizen burst, highlighting we really need to improve this area and this is where we should focus. Next slide, please. And then, adding some work-specific icons, what might be in person, or what might be a video call or a phone call. What is handwritten versus using a computer? Is it a group decision? So thinking about if you're adding additional work-specific icons, what is going to help with reading the map? And that, that adage, just because you can doesn't mean you should. So really being mindful of icons that you're going to add. Next slide, please. this is an example then of what would happen if you were to put all those elements together. So you have your supplier in the upper left doing a manual push to what happens at that first step. Between step 1 and 2, database interactions. At the end, the customer is getting what they need. Down below, you would have your time metrics, and then additional icons and indicating where you have bottlenecks, issues, and waiting. Next slide, please. I just wanted to share some recent VSMs that I did. So back in mid-April, I did a quasi VSM with our home and community services staff in the Spokane office and the Regional Area Agency on Aging regarding presumptive functional eligibility for our in-home clients. They've been doing a pilot project with a plan of rolling this out statewide. And before rolling it out statewide, they wanted to, make sure that the process was working so that they weren't going to, continue to have a process that wasn't working either for customers or staff. So also, why two different maps? Well, two different processes. The area agencies on aging have a slightly different process than when clients enter the system through home and community services. Next slide, please. So if you can't be at the in-person meeting, or if you have, because usually VSMs, you're going to have a select number of staff compared to the number of overall staff who might be involved in the process. So one of the supervisors in Spokane put together a survey using updates and teams to gather feedback. And, in doing this, it really messaged that all feedback is welcome, encouraged, and value add to the discussion. So all staff who were, doing the work had the opportunity to give their input and feedback, and that was incorporated into the final product. Next slide. So bridging the gap. So towards the end of the time that we had together with the AAAs, we were helping to design that future state. And so we had each table think about the infinite possibility. So forget about, how things are right now. If you could make, that proverbial wave the magic wand and create the process that you think needs to happen to design the ideal state, what would it be? Thinking about what you know from your customers, what do you think it should look like? And so there were definite themes that came out from this event as to what the ideal state should include. They knew, based on feedback from current clients, where there were issues from the customer perspective. And right now they are doing additional investigating so that as this is rolled out statewide, they're really keeping the customer at the forefront. Since this event, the team is right now evaluating the feasibility of those recommendations that they received. They are doing individual with each region, identifying what is your intake process like, what do you think should be included, and it's just really exciting to see. And I also just want to acknowledge that the HCS leadership really gave the opportunity to staff to say, if you could develop the ideal state for presumptive eligibility, what would it look like? And I think that's just awesome because it really gives then staff that sense of ownership and onus that, hey, we're doing it and we know it works, and we don't think that, 3 different entities should be asking customers or clients the same question. It doesn't make sense to ask this question here. So it's fun to see what's come out of that value stream mapping event and where things are going. About how you collected. So we had everyone, this was an in-person event too, so that helped. But we had a big sticky notebook paper, and they could draw. Some, drew it out process box by process box. Some just wrote a list. So we gathered that from each group. We had each group do a report out, and then that information was summarized and grouped into themes. So the how, if we can move on to the next slide, please. So how do we get started with creating a value stream map? Next slide, please. So use a project charter. I saw that from the chat earlier. We do a charter because it demonstrates leadership's commitment to making needed changes. We want to keep it simple, make sure that we are involving the right people, identifying too, like, what is the starting and ending point? Most processes are very complex. And so figuring out what part of the process are we going to focus on. Also, it's important to map the actual, not the should, at least with the current state. And use as much actual data as you can, not assumptions. And then analyze as a team, and then work on designing that future state. And then one of the other things that are critical to doing before doing a VSM is doing a SIPOC. Next slide, please. So SIPOC is an acronym for a process that includes identifying your suppliers, your inputs, the process, outputs, and customers. So provided I gave you a SIPOC tool that you can use for your own. When doing a SIPOC, I was taught to start in the middle. So what is your process? What are 4 to 5 high level or up to 9, I want to keep it relatively short, overall steps that need to happen within your process. And then you can either move to the right and, talk about what are the outputs of the process and what gets created, and moving on to your customers, who's benefiting. Or, and this is what I like to do, is after you identify the process, well, what are the inputs for that process? So what do we need to get started? What are those data elements? What is the information? What is the technology? And then who's providing that? And then from after that, going back, and then, well, what are the outputs, and who are the customers, and who's benefiting? So mapping the actual versus should. So even if actions are mandatory, you want to map out how it's actually occurring, and then identifying where is there variance from standard, where is there variance from policy, where is there variance from, what is in the process or procedure guide, so that you can then identify why is that happening. And often it comes down to there's no standard, or standards aren't reinforced. So it's then an opportunity to figure out what you can do to support staff and managers to ensure and hold their staff accountable for following the process. Does it answer your question? Okay, I'm seeing a heart icon. Perfect. So when we think about our supplier, it's really that source of the information or the referral. So what is really the kickoff for our process? Because we also, want to make sure that people aren't products. So we're not like supplying a person, but really what they're doing is that supplying that information and paperwork and knowledge, so that we can provide the information that's needed to complete the process. Next slide, please. I'm also being mindful of the time here. So this is a draft of the SIPOC that came from some initial discussions, initial Gemba work, talking with the staff. But at our pre-meet and also at the in-person, we wanted to make sure that we heard from everyone. So we shared this, and there was missing information, and so we in real time updated the SIPOC to reflect what was needed. And then we also talked about the need to change the language of stakeholders to partners in order to be more encompassing and respectful, particularly with respect to our tribal partners and our government to government relationships. So I believe that the template that I provided for you doesn't have that stakeholder language, but there's a place for adding the partners at the bottom. Next slide, please. So final tips and takeaways. As always, keep the needs of the customer at the forefront. You are designing or redesigning the process to make it better for your customers. Again, draw the actual, not the supposed to. Just make sure that you're consistent with your time metrics. So if you're using minutes throughout, use minutes. If you're using hours, use hours. Make sure that, again, you're using roles rather than names, and consistency, again, with other data box elements. As with process mapping, with value stream mapping, you want to get through the process and then come back and identify where there are issues, where there are challenges. Often, there's lots of issues, there's lots of opportunities for improvement. So talking with the participants and asking them what do they want to prioritize for doing a root cause analysis. A simple root cause analysis is the 5 whys. Just keep asking why until you really get to you can't ask why any further. And as always, with anything lean related, focus on fixing what's within your sphere of control. There might be things that we identify that we don't have any control over. So really focus on what does my team have ownership of, what policy do we own, what processes do we own, and start from there. And if there are cross-team or cross-even administration, cross-agency processes, making sure, again, going back and making sure that you're involving the right people. And then start to think about that future state. What is the ideal? If we could just start from scratch and draw the policy, draw the process as if nothing else existed, what would that be? And then closing the gap and figuring out what is it going to take to get closer to that ideal state. Next slide, please. So any questions, anything else that has come up that I didn't catch in the chat or anything else that you want to know about VSMs? And thank you, Don, for your comment about the VSM with HCS in April. It was fun.
Awesome. Thank you so much, Beth. Any questions while we have Beth on the line? I know she was an expert at answering as she went, but if there are any questions y'all have for her, feel free to come off mic or raise your hand, whatever works for y'all.
Or if you have like other advice, other input, I always think of this as a collective, as a, other people have different experiences and other knowledge to share. So feel free to drop that into the chat too. Or if there's anything that you think that I missed, please drop that into the chat as well.
Yeah, absolutely. Hey,
Hey,
T.
oh, hey, you. I was going to say it's Talia. I just wanted to say, thank you, Beth, for covering the TAC time. I know, as practitioners who facilitate this, often we don't always get a chance to use that with the government work that we do. But I know that was one of the things that I'm like, I don't see this enough. I don't do it enough. And if you don't use it, you lose it. The knowledge was slipping. So I really
Yeah.
appreciate you going into that piece. And yeah, I'm just kind of curious. I know somebody mentioned earlier, are people still doing VSMs these days? And do people still do Kaizens? And I'm curious, with those couple comments, it made me question because we over here do them. We'll do them with ourselves, we'll do it with other agencies. And so I'm just curious, are folks still using this out here because I really
Mhm.
think this presentation today was just a great reminder to bring us back to the basics of lean and continuous
Mhm.
improvement and
Yeah.
remember just how useful this tool is. So yeah, just a question to
Yeah.
throw out there. Are there folks that still use this? And if so, is it like super helpful and useful in your area or what? There's got to be some other people out here that use it.
Yeah, and then I also want to address what people are dropping that into the chat. There was a question about, do you have any tips for helping people understand what's within their sphere of control?
Mm.
Um, a question that I will ask if people, are like, well, it's like, who's really responsible? Who owns the policy? If you make a change here, who else might also have to make a change to their process? So thinking about the upstream or downstream impacts. Um, if you make a change, are you expecting someone else to also make a change to what they do? If the answer to that is yes, you are working outside your scope. That's where I start.
Mhm.
Oh,
Yeah,
looks like
great
we also got a
advice.
question from Alicia McCoy. Are you willing to come back and provide a training on WBS?
Ooh, is that work breakdown structure, Alicia?
Oh, work breakdown structure. I am not an expert at WBS, but I think that there are others within this community of practice who would be um, great at that.
Oh, we could definitely put it on the docket, that's for sure.
You already know. I'm listing it
I
now.
see her just writing over there. So we got you, Alicia. Love it. Whitney
Let's see, thoughts to
actually,
introduce.
yeah.
Yeah, looking at that same Teresa, my mouth. Yeah, so if you were to lead a VSM for the first time, for those that are more familiar with like the flowchart, swim lane maps, that this is taking that flowchart, swim lane map to a next level. So if we were to remove all the decision points and just assume that it's yes, or the continue, whatever the answer is for a continuation, moving the path forward, continuing in the process. You're going to now start to add some data. So, this is what we think happens. This is, what we know happens, first, second, third. But, we know that our process is taking too long. Or we, don't have the resources to meet customer demand. And so, how long is the step taking? How much wait time is there? And so really bringing in those data elements um, is a good way of helping people to make that transition from standard process mapping into value stream mapping. Does that help, Whitney? Just do like a thumbs up or icon or, yeah, okay. Awesome, thank you.
Awesome. I love it. Any folks who have used VSM or use it frequently, are there other tips and tricks that have worked for y'all that you want to share?
Okay, before someone else speaks.
And it's okay to contradict anything that I've said too, because we all have our own experiences. So,
I wanted to highlight something else that I saw that you showed with the SIPOC, for example.
oh,
Often when
yeah.
we do like a Kaizen or a SIPOC with folks, I like how you really emphasize in the process, we're just looking for high level phases here. And I just want to say that's super helpful for anyone doing a SIPOC for people. It's really easy when you're doing this for a group, especially a group that you don't have any stake in the work. You're just facilitating, like an outsider facilitator for them. And it's real easy for folks who just want to get in the weeds of the process steps of that P in the SIPOC. So just another happy reminder with Beth's visual to just stay focused on those high level phases of the process and let people know you will get into those, more in-depth granular details later with a full out VSM. But I have seen a few folks try to facilitate that and like kind of get lost in the sauce with the conversation and just go into the detail. And it's like, no, like stand your ground. We're
Yeah.
only doing high level phases here. I'm sure
Yeah.
everybody on this call knows that, but just can't say it enough because Because that little piece really helps set the stage for the buckets and phases
Yeah.
that you're going to put all the
Yeah.
other steps in.
Yeah. Whitney says
Yep.
that she uses the term happy path.
Yeah, exactly. Like if
Yeah, I like
everything
that.
was, I've said that too. If
Like
everything was to go great, how would it look?
right.
Absolutely.
The
Uh,
yeah, blending Bob Ross with process mapping and value stream
There
mapping.
you go.
right. Absolutely. Before we get to Naomi's comment in the chat, I saw Dawn, your hand raised.
Yeah, I do. Yeah, thank you so
Hello.
much. And Beth, this was amazing. Even with some of the tech issues in the beginning, it was still such a great refresher course or initial for anybody. So it was really cool. The visuals were awesome. Just one thing I wanted to bring up because I know everybody here is feeling it with the current budget situation. Probably everybody here that listened to this VSM knows the value of them, right? And how do we continue to remind our executive leadership how much value these have for the work? And how do we remind them that if we're going to spend any money on events, that this one is really, really worthwhile because it takes a lot of time and resources. So I'd love to hear people's comments and ideas about how to keep reminding leadership that there are some things that we really need to spend money on so we can save money later, right? So yeah, how are we keeping our executive leaders aware of the importance of the VSMs?
That's a good question. I'm also going to just add on to that for whoever wants to answer this, but I'll say not only money, but uh, the time. People are scared to take time away from their crazy, chaotic workload to do this. Like a lot of people are like, okay, that's great, but I don't have time to do something like this. And it's like, we need to take the time so that way we can prevent, further chaos down the road. So good point. I have some thoughts, but I'll hush for now and see if anybody else wants to answer that.
I'll just say, I know
Yeah, I
we're
just
have.
dropped into the
Oh,
chat
go
that
ahead, Beth.
we need to be better at making improvement work as part of the daily work, and just making it part of our daily practices. And I think as leaders need to be better at incorporating lean leader standard work into their daily work and accountability. Um, but yeah, it's hard.
You
But yeah,
said it.
Therese, we don't have time to not.
I think you said it right there. You kind of touched on where I was going to go. Standard work, right? Standardizing
Yeah.
processes. If we want to be great at the customer experience or the user experience, we have to have standardized processes so that we can be like promoting and displaying consistency all across the board. And one of the things that I've done when pitching, hey, we need to take the time to do this to leadership, is I've demonstrated, there are several people on a team or in a division doing the same process completely differently to where it's not the same process, and therefore people on the receiving end are not getting the same product because of those differences. And so doing something like this really shows where the kinks in the process are, where the ball might be dropping just because of a couple steps that are done a little different. And so that can make or break a customer experience. It can make or break, it cost in some issues. So it's just, and time, definitely time. Might be taking this person this much time to do a certain process and they're not meeting their quota. And it might be taking this person like no time at all and they're constantly the employee of the month. So it's just like consistency.
Yeah. And I'll just add to, Dawn, I think it's really important, before even kind of diving into the process, I think Beth really touched on it, like start with the charter. Like that is your authorization to kind of continue going forth. But even before that, leaders like to kind of know like the return on investment, right? And being able to show that with data, and having them, be able to make data-driven decisions, I think is really important. Like showing them like, hey, this is how long, it's currently taking, this is how many like errors or deficiencies that we're seeing, like being able to come with those specific data points, I think would be helpful in order for them to see like, oh, this is actually something that we need to really address and tackle and show improvement. I think being able to show what that return on investment could possibly look like with specific Smarty goals could be helpful as well. But Beth did say, start with a process map, create it as a team, identify where there are differences and how something's done, as well as variance from policy. Yeah, absolutely. Yeah, and Sharice, a good point. She also put in the chat, we don't have time not to make
Exactly.
improvements. I feel like especially with, yeah, 100%.
What
Like,
is that example? I can never think of how to say it, but y'all know the example. Like someone's like sweeping water off the floor, mopping it off the floor, but no one stops to go and shut the faucet. That's like flooding the whole
hmm
kitchen.
Yep,
That's
yep,
that's what it looks like when you don't take the time to do this stuff.
yeah, absolutely. It's so imperative right now. Awesome. Any other questions, comments, additions, that have worked well for you all? We have about 6 minutes left, but great discussion.
I just want to add that, you know, segment your process. Like we tend to know where there are hangups. We tend to know where there are challenges. Like we know where we get a lot of customer complaints. So start there. You don't have to do the entire process. Just do a small segment and say, we want to improve this stage for our customers,
Mm.
um, and focus there. And that I think is a little making it bite size, while recognizing you also have to think about the upstream and downstream impacts. Um, is easier sometimes for leaders to buy into changing, especially if they're also getting calls from our constituents and the public around that area.
Yep.
Um, Thank you, Cherise. Yeah, small wins build momentum.
hmm Absolutely.
I know I already dropped this in the chat. I'll just drop it one more time in case you've been so engaged in the conversation you haven't had a chance to do the survey.
Thank you.
Aside from the
Awesome.
uncontrollable signal issues.
I know.
Right.
Wonderful. Yes. So wonderful, Beth. We might contact you just for maybe a little voiceover on the front end, just so everyone can get the full impact of your message today. We just appreciate you so much for being here with us, and I'm sure we'll see you soon.
Yes.
I love
And if
it.
you're within HCLA, feel free to reach out to me. I do consultations as well. So yeah, my calendar is open for that. So yeah, reach out if you're within HCLA.
Hey.
Thank you, everyone. I'm going to stop this recording now. Great Q&A session.
Yay. Thank you so much.